Welcome to Supreme Dental Podcast Studio. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Look, you can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Also, we have a phone number and an email address that you can contact, leave any questions or concerns, so we can talk about it in future podcasts. Remember, this podcast was meant for you, the patient. Today we got someone very special to us here at Supreme Dental. His name is Dr. Elias, and he is an implant specialist.
That is correct. Hello, everybody. Hello, Frank. How are you?
Pretty good, pretty good. We're going to talk a little bit about implants. We're going to talk a little bit about hybrids. That's the big thing right now. Besides veneers, this is the second hottest subject. Right. You know, there's a lot of commercials, and I've been mentioning it throughout different podcasts that we've had here. Is all the commercials you see is implants. I walk in, I walk out, I'm ready to go. I never have to worry about things again. I'm happy, I'm smiling, I got my life back. And we want to know exactly what are the truths about that, the not so much about that, so everybody's well informed. So one of the things that we get here all the times from you guys is, you know what, I came in and they told me I needed to extract all my teeth.
Right.
They told me that I can't save them, but then all of a sudden you guys take x-rays, you guys take a CAT scan, and you can save the teeth. So what do you tell to the patients out there that have something in mind, to think that by just pulling, they got rid of all their problems? What is your take on that?
Well, basically, I think the first thing that we need to do is that we need to take an evaluation, right, of where we're at with people's teeth. Now, in my opinion is, if we can save the teeth, we should save the teeth, right? It's never the same having implants than your natural teeth, right? But it gets to a certain point where the teeth themselves, what we call terminal dentition, what it basically is that the teeth are not going to last more than 4 or 5 years, right? We understand as well that this is an investment that people are going to make. So we have to weigh in what people want, what they have at the moment, and at the future. We must look at the future as well, because we look at a treatment, something that's going to be successful, something that's going to last more than 10 years, for sure.
You know, that's a very good subject there, because there's a lot of places that they go and they do whatever they want them to do, and it only lasts 2-3 years.
Right.
Or a year or 2 years. And obviously that's a big investment. You know, some of our patients out here have been saving up most of their lives to be able to get this done. So, you know, I haven't touched upon that on the other podcast, but that's a very, very good point. So at what time do you suggest, you know what, now I'm going to pull? Now, what's the next step to tell the patients? What are they to expect when you say, you know what, you're right, sir, you're right, ma'am, we are going to have to extract 25, 28 teeth, and your only option is all on 4, all on 6, pro arch. How do you go about that?
Well, it's a tough decision, right? It's something that people are never really looking up to having, right? People will never imagine that they're going to get to this point. But it's a step that we have to take. The earlier, the better. Why? Because there's more bone. It's easier for us to actually place the implants without actually having to go into major surgical procedures. It's tough. I have to be honest with the patients. It's tough. But there's a light at the end of the tunnel, which is best for them at the end of the day, for sure.
So what do you suggest about those patients that say, oh, no, I don't want a CAT scan. I don't want to take a tomography. I've been told that I can get implants. Is it very important for the patient to take a CAT scan?
I think it's the first step. The first step, I think, it's to talk to the patients, see what they've been through, what they want, what they need, and previous experiences, right? But with the CAT scan, what it basically is that it lets us know the terrain that we're going to work on, right? It's like building a house, but we must know how the foundations are, right? We must know the length, the width, the depth, the type of bone. There's a lot of things that go into the CAT scan. It's not just a two-dimensional image where we're not really seeing what we're getting into, right? It's also a lot of anatomical structures that we must go and see, right? Because we have to play with safe measurements to know exactly not to touch a nerve or to touch a blood vessel or things like that. it's pretty much, for me, it's impossible to actually give you the correct treatment plan without a CT scan. I think it's essential.
So pretty much what you're saying is that there's no universal implant.
No.
So there's not one size fits all.
No, not at all.
Very, very important, guys, because we get that all the time. And, you know, we appreciate all those patients that talk to other dentists, or we appreciate the patients that have gone online and now they feel like they're dentists and they know exactly what they need. These guys go to school. These guys go to trainings. These guys have been specialized. You know, whoever you guys decide to go with, make sure that you guys put your trust on them and you hear what they got to say and why things are taken. And talking about that, you know, we get a lot of doctors that like to do different courses online and, you know, at their hometown, and there's nothing wrong with that. But you just came back from Spain last week. Actually, you came in Monday, kind of jet lag.
Right.
So tell me a little bit about where you went to Spain. Canary Islands. Canary Islands.
Yeah.
And let me know, how was your experience there? What new techniques you learned? People that you met? You know, definitely share that with us.
Yeah, well, the course was called Dentalism 2023, right? I think it's the biggest course in the world about a dentulous patient, people that have no teeth at all. Where it's their last option. You know, we talked a lot about pterygoid implants. We talked a lot about zygomatic implants, which are where people have no bone at all. There's some doctors out there or some clinics that don't do these type of procedures, and they just tell the patient that, you know, they're not a candidate for implants, and it's not true. I've got a chance to meet some of the greatest, the top full arch surgeons were at that course from all over the world. Europe, Asia, America, and I got the chance to talk to them and, you know, have some questions for them or some surgical tips or techniques, and it was pretty cool. It was pretty fun. I learned a lot. I think we could get better, right? I think that's the key, right? You look at things and you see what other people are doing around the world, what works for them, what hasn't worked for them. So it gives us a better view of what's happening around the world and what we can actually get together and give our patients a better treatment, for sure.
You know, that is actually one of the things that I've been saying, and I let different companies that we work with know that we don't compete with dentists here in Los Algodones, Mexico. We compete with dentists in the worldwide. You know, there's always something you can learn from somewhere else. You know, a lot of people get stuck at what they do, and there's so much out there. There's always something else to learn. People have asked us, patients have asked us, why are your dentists so young? You know, they're late 20s, they're early 30s. But they're the top of the top. You know, you guys are open to procedures, new procedures. You guys are open to trainings, seeing what's out there, but not going something that's brand new after it's been tested, after a percentage is pretty high as a success rate. You guys go on and you guys go to the next level. And that's something that I believe that our patients here really, really appreciate. If you actually go on our Instagram, Supreme Dental Clinic, at Supreme Dental Clinic, you'll see some videos where Dr. Elias comes out, numerous of our doctors. I have not yet met another clinic that does what we do, which is extractions and full mouth restorations, and, you know, and patients still want to take pictures. You know, there's patients that you just did 26 extractions and 8 implants and they want to take a picture, you know, and that's obviously something very, very special to us. One of the things that also comes to my head is nowadays we have a lot of, to me, my opinion is depression rate is extremely high. You know, people are depressed. People don't feel well about themselves. And I believe one of the main purposes is, you know, dental. You know, right now we have social media. You put on your Instagram, you put on Facebook, Twitter, TikTok, and whatever else is out there. And you put it on and you see this young guy, and he is completely ripped, you know, and he is on a boat, on his Ferrari, on a yacht with like 15 girls around him, and everybody's like, oh my gosh, you know, I'm 34 and this guy's 25 and look at how successful he is, right? And we create this illusion of what our life should be like. Social media is great and very informative, but also has their downsides. And to me, in my opinion, I believe that us being able to give someone back their smile by doing these all-on-4, all-on-6s, pro arch, gives them something more, a lot more than something that, like a car or a house or nice clothes or jewelry. It brings them back a smile, which that's their beauty, you know, their beauty in your face. There's nothing more beautiful than having a smile. You know, it doesn't matter if it's white, it doesn't matter if it's not as white, but being able to smile, to me, shows that confidence. And if you're confident, you get someone who's confident, they'll take over a country. You know, they are very good. They believe in themselves, and they keep on moving. And I believe that's something that you guys do here at the clinic. Also, I believe that one of the things that patients have been asking a lot about are immediate loads. Now, what exactly is an immediate load, and what's the difference from having your conventional denture of walking out with something of that nature? What does that entail?
Well, the immediate load, what it basically is that right after the surgery, right after we extract the teeth, place the implants in, you're actually going to be able to leave the clinic with teeth in your mouth, right? And I think that's something very, very important, something that before we didn't really appreciate, right? We just thought, hey, you know, just take the dentures, go home, and come back. But the dentures,
everybody hates the dentures.
Everybody hates the dentures. Yeah, they never really fit. You know, people cannot eat. They can't talk. You know, they don't feel comfortable. And we used to think, the dentists back in the day, we used to think, well, it's only 6 months, right? But in 6 months, a lot could change, right? But we've noticed now with the certain techniques and things that we have learned, that if we're able to place the right amount of implants in the right position on the right type of bone, that people are going to be able to leave that day with teeth in their mouths. And it does make a big difference. We have to look at people who are candidates and people who are not candidates, right? We have to take a look at their medical records, and the CT scan plays a really big, important role on this, so we can actually know where we're going to anchor our implants, right? It's not like you just come in, you sit down, we yank the teeth out, we place the implants. No, we think about what we're going to do. And I think one of the advantages that we have here at Supreme is that we have 4 dentists that do all-on-4 surgery, and we complement each other a lot on what we're going to do. If we have a tough case, you know, we brainstorm and then we execute. And I think that's really made a difference between our clinic, that we don't compete with each other. We're actually, you know, working as a team to do better. And for the patient to actually leave with teeth in their mouth, you know, it's they could eat better, they can speak better, they see themselves better, you know, because people can come in with like really bad teeth, and we put some really good temporaries in. Temporaries are going to be like the teeth are going to be in your mouth for only 6 months, right? There's certain limitations on the type of food that you're going to be able to eat, but as far as speaking, people are going to be able to just go on with their life.
Yeah, and that actually makes a huge impact, because patients come in, they walk out, and now it's a different person.
Right.
It's a different person. It's and you hit a very good thing that I wanted to speak about. A very good topic is, like every procedure that we talked about, veneers, we talked about root canals. There's many different things that we're talking about at this podcast. But one of the things is that I believe is 50% of 50% of the responsibilities here. The other 50% is done at home.
Right.
So you need to maintain. There's certain things you can't eat in between those 6 months. There's certain things that you will not be able to eat the way you used to or want to eat it before. It's not just a change in smile, it's a change in lifestyle. Right. Whatever you were doing before was not working for you. That's why you're here. And True. That's why we are replacing what you had before. So you'll be able to eat an apple, but you won't be able to bite into it. Perhaps you'll be able to eat corn, but perhaps not corn on a cob. So it's like me having a leg, and that's not part of me, but I'm able to walk. But then again, I want to squat 800 pounds. You know, it doesn't Right. It doesn't work that way. So that's very, very important that you hit up on that point.
Welcome to Dental Facts. Did you know It takes 43 muscles to frown and only 17 to smile. You heard it first at supremedental Podcast. Floss, brush, and keep smiling.
And one thing that I've been saying on throughout our podcast is, guys, we are not actors. We are. He's the doctor. He's a real doctor. My wife and I are the owners of the clinic. We decided to do this podcast to inform you guys about everything, about what's going on, any questions you guys have, concerns that we hear. We've been open for 15 years. We've came out in numerous things. We came out and I mentioned the New York Times, HuffPost New York, and we see this day by day. And we don't see podcasts. We see podcasts of dentists for dentists.
Right.
That's awesome. But and with that, I tell you, I mean, obviously we're not we're just flowing. What you see is what you get. We're extremely transparent here. So if you guys ever were to visit us, you guys will be able to see who we are. That to me, there is two different types of dentists. There is a dentist that becomes a dentist, and there's a dentist that is born a dentist. And I like to say that everybody here at the clinic are born dentists. That's how we choose our staff. That's how we choose our team. That's how we welcome you guys to join the Supreme family. And with that, you were actually just in a surgery
right
before you got here, probably about an hour and a half ago. And what were you doing in that surgery?
We were doing an all-on-4 surgery. So the patient, she didn't have any teeth in the top for about 20 years. And she had what we call terminal dentition, which I mentioned before, that her teeth were failing. In the bottom, she had 10 teeth. And so we talked about options, and she wanted something fixed, something that she didn't have to take on and off, which a lot of the patients are looking for that now, right? And we must look at options. So her bone in the bottom, it's fairly easier. There's always bone. The only limitation is the nerve that we have. But in the top, that's where it gets a little more tricky. It tends to be a little softer, but looking at the CT scan and certain techniques that we've learned throughout our experience, where we were able to place the implants with no problem. The surgery was about 2 hours. Everything went great. She's now recovering, and we're going to see her later on today to see how she's doing.
That's amazing. I don't know how they do it. I would not be able to stick my hands in someone's mouth and be able to do what you guys do. Now, a question that I ask everyone here is, obviously you've been here for approximately 6-7 months already here at Supreme.
Right.
And what is one of the cases that you've seen here that has somehow, some way marked you in a good way of something that perhaps somebody gave you a hug? Because everybody sees, and you guys can go on Instagram, we're at Supreme Dental Clinic, and you can see the numerous videos of you coming in, of you putting that supreme magic.
Right.
But what is something that you remember, something that you're like, well, I remember this case a lot?
It was actually that patient from that video. So he came in, he was a little bit lost. He really didn't know what to do, right? His teeth were moving. You remember that? He would speak, and his teeth would move.
He had the little...
Yeah, those just all over the place. And he was really concerned, right? Not just because of how he looked, but also because of his health, right? Because a lot of our digestive system starts in our mouth, right? And if we're not able to eat properly, that's another thing. We have to balance out function and aesthetics, right? So we have to put them in together. But he was really concerned with function, with his health. But we could tell when you talk to someone of how they don't smile or how they try to cover their mouth. And he wasn't really concerned with that, but he wanted a great smile at the end of the day, right? So the changes that happened in 3 days when he came in, we did the evaluation, we looked at the CT scan, we talked to him, we took photos, we took certain scans, so we can plan out what we're going to do, right? Because everything is planned out. It's not just you get here and that is that. It kind of hit home when we put the Temporaries teeth in, which looked great, and he felt like a new person. He felt like when he was young, when he was in his 20s. And he was really shy at first. He didn't want to take any pictures. He didn't want to do any videos. Yeah, remember that?
Yeah.
He didn't want to do any interviews, but his aura just changed. He wanted to be in front of the camera. He wanted to talk to other people, and that's when it really hit home, when he wanted to get the message across to other patients that are probably feeling the same thing, to motivate them, because he felt that way. He felt that there was no solution to what he had, and just by looking at his temporary teeth, his vibe changed.
He actually asked me. He asked me, why would you want to record a video? And I said, well, when patients see your smile before and after, they're gonna know that no matter what they have, there's hope. And he said, let's do it. So, and with that, obviously, Elias has that supreme magic, but we also want to give a big shout out to the guy who does all the recordings of this video. His name is Jorge Tellez. He's actually behind the videos right now as we speak, from Torreon, Mexico.
Right.
He does great magic with, he's with the camera. He's the one that's doing all this. The podcast has really helped us out. And in more than anything, he has an eye to capture these videos, these angles, so everybody at home can see perhaps the pain that they were in, perhaps not physically but mentally, and the big difference that it makes, because the magic, it's like a boxer. Boxers are not they don't become champions in the ring. They're just recognized there. They become champions while they're training. They become champions while they're pushing the limits, just like you guys. And in Jorge George, he really captivates that. And I need to give him a Kleenex because he's probably crying right now. But he's a great video guy. He's not great at picking soccer teams or football teams, but he is very good at what he does. So, Dr. Elias, quick question. So, how do you help patients pick? Because obviously they're gonna do an all-on-4, top and bottom, all-on-6, pro arch. But how do you? What are the different choices that they have on materials? What do you recommend for the patients?
All right, so there's different type of options that we have. What I would really recommend is always the best, right? What I would recommend for my dad or for my mom, we know it's an investment, but you must also look at the future, right? Maybe it's going to be a little more expensive than other things, but the zirconium with the peak structure, we believe, in my opinion, and what we've seen here, is that's what works best. That's where we can actually balance out aesthetics with functionality as well. Something that's going to last very long and something that's going to look really good as well, right? But it's like everything else in life. It's like when you buy a car, you have to give maintenance, to that. You have to come back every certain time. It's not every 6 months or every year. Every patient is different. We're going to see how every patient, how they take care of themselves, right? Or if they have any types of bruxism, or when they grind their teeth, every patient is different. We usually recommend between 6 months or a year here with us or with their local dentist at home. It's just to see if we can catch anything, to make sure everything is fine, everything is working. But the zirconium with the peak structure, it usually works really well.
As you know, there's great dentists no matter where you go. North America, South America, Europe, great dentists. But there's also not so great dentists that forget to inform their patients after you're done, after you get home. Now, how do you proceed? You have already your final work in your mouth. You have your implants. What do you suggest? What is your opinion on that? What do you suggest for everybody who's watching at home, who's about to get this done, who's in the process of saving, who already got it done? What for them to expect?
I think that's when the treatment actually really starts, because we have to take care of the investment that you made, right? There's, as you mentioned before, there's a reason why this all started, right? We have to address the cause of them probably losing their teeth. We have to change probably the way they clean their teeth.
Their habits.
So we got to get that straightened out. We also have to tell them and show them how they're going to take care of them, right? If it's going to be with the water pick or with the super floss, and it's going to be something new. At first, they're going to have to learn how to eat again, probably. Probably think about, in my opinion, right? Think about the way they're actually moving their jaws. because it's different from having your actual teeth than to actually having a prosthesis over implants. It's a little bit of a different. Your brain does need some time to actually get used to it, but it's all muscle memory. After a while, you're gonna do it by yourself. But yeah, that's pretty much what I would consider habits, maintenance, and probably trying to visit here maybe once a year, 6 months. It depends on every patient. Every patient's a little bit different.
Oh, well, with that, we're going to go ahead and wrap it up. Thank you for joining us here. We really appreciate what you guys, the opportunity you guys have given us. Don't forget to like, subscribe. We got a phone number and we got our email here. You guys can send us your questions. You guys can send us your concerns. You guys could just say hi. We can give you guys shout outs. Thank you so much for joining us here.
Frank.
Thank you so much for joining us at home. And we'll see you next time. Supreme Dental Clinic, where smiling starts here.